from the station that's on your side. This is Channel 7 News Daybreak.
6:42 is the time. Now to that controversial new study that has some women questioning whether or not they should get mammograms.
In an age of overdiagnosis and overtesting, the study says that around a third of women are getting unnecessary treatment. Channel 7's Elizabeth Armstrong spoke to local doctors about the takeaways from this study. Hi, Elizabeth.
Hey, Allison and Chris. Experts are encouraging women to take this study with a grain of salt. I spoke with a doctor from Baptist Health that says it has not been interpreted properly. One of her patients, also a doctor, agrees and says regular mammograms are vital tools for diagnosis.
Dr. Beth Milligan had no symptoms, so when a routine mammogram turned up cancer, it was a surprise. But she immediately began treatment and is doing well today.
I'm very healthy. I did go through aggressive surgery and radiation, and I take medication now to decrease my recurrence.
Her cancer was discovered at the Baptist Health Breast Center by Dr. Ferrell, a radiologist who's been screening for 14 years. Both women are distressed by this new study on mammograms, showing that they can result in overtreatment. Dr. Ferrell says the methodology for this study out of Denmark was based on faulty logic.
It is a very flawed study.
It indicates many breast cancer patients did not need treatment because their tumors were slow growing and therefore possibly harmless. But Dr. Ferrell disagrees because right now scientists can't predict how cancers are going to grow.
Cancer isn't always a linear thing, and so it can pop up and be invasive from the get-go.
Cancer also doesn't ever regress.
People get this idea that, oh, if you're overdiagnosing it, that the cancer will just go away, and that's not true.
That's why, in spite of the study's results, it's important to treat all cancers. Dr. Milligan feels the same way. As a physician, she's upset that this study was published because it confuses her patients.
I was worried for my patients if they would think, oh, I don't want a mammogram, I don't need to have it done.
And as someone who's had breast cancer, she's encouraging everyone to continue screenings.
There's no doubt in my mind that mammography played a role in helping me get my diagnosis, and I would never go back on that.
Dr. Milligan added that the new study does not say to avoid mammograms, but it is calling for more research and information. While this study puts the rate of unnecessary treatment at about 33%, another study out of Denmark says it's much lower, just 2.3%. For now, most medical guidelines are still recommending mammograms every year for women over 40.